Newsfeed Now. Coronavirus facts, not fear, begins now.
Good morning, good afternoon to you. Thanks for joining us for Newsfeed Now. I am Aaron Nolan. April the 7th, the date. We continue to look at COVID numbers. That is obviously why we are here. We are focusing on facts and not fear. Nearly 400,000 U.S. cases. Right now we're looking at 368,000 cases in the United States. More than 11,000 deaths. As we have been reporting for a week and a half, almost 2 weeks now, New York is the epicenter now of the cases. 133,000 cases there. Where it all started, I remember way back when, 3.5, 4 weeks ago, the Seattle area was a hot spot. That's kind of leveled off. 8,000 cases there. As I take a look around this map, Illinois, the Chicago area, 12,000 cases. New Jersey, 41,000 cases. So a lot of cases. That continues to be what's going on. Let's get to some coronavirus headlines right now. Facebook joining the fight. The social media platform working with researchers to use its data to slow this thing down. This is interesting. Facebook will use tools to help predict where COVID could appear next. The platform is able to analyze collected data on population movement and connectedness. Of course, a lot of people are a little concerned about Facebook. I promise you, though, they're going to work to make sure hacking is not possible in this situation. Auto insurance companies, my wife was talking to me about this today, are giving money back to customers because people are driving less. Allstate says it will refund about 15% of premiums paid by customers in April and May, $600 million worth. American Family Insurance says it's giving back about $50 per car for a total of $200 million. Both insurance companies say they are expanding coverage. This is something that's also interesting to me. For customers who use their own vehicles for delivery services and medicine, again, really good news here, as many businesses as possible try to help out. But Progressive says it is still exploring options. All right, let's move on to the news of the day. This is a big one. This is one that's been talked about since I saw this information early this morning. Wisconsin's primary election is going on as planned, despite the state's stay-at-home order and a day after two courts ruled that the election could not be postponed. Critics raised the prospect of major election problems. Given that thousands of poll workers stepped down, that led the state's largest city, Milwaukee, to reduce its number of polling places from 180, listen to this, 180 down to 5. More than 2,500 National Guard troops were dispatched to staff the polls where they were expected to help perform the normal functions of poll workers, while also, good news here, giving out hand sanitizer.
A lot of people are wearing masks. All the employees are wearing masks and gloves. We're wiping down as often as we can. We're cleaning the pens and swapping those out when we have a moment to do so. And so far, everybody that's coming in has been very patient, and we are grateful for that.
Let's go live to Wisconsin, but first I want to read a tweet from the Lieutenant Governor of Wisconsin. Calvin is here joining us. Calvin, I want you to respond to this and how people are responding to this. This is from the Lieutenant Governor. Good morning and welcome to the blank show. You can see that that is the S word that was tweeted here. Today's episode has been produced by the Supreme Court and directed by the incomparable Speaker and Senate Majority Leader duo. Buckle up. This one's sure to disappoint. All right, now this is one here. As we look at this, this is one I think a lot of people are going to start talking about this one. What's the thought process right now in Wisconsin as we continue to have this primary election?
Yeah, good morning, Aaron. Obviously, as you mentioned there, the tweet coming from the Lieutenant Governor himself, Mandela Barnes, here in Wisconsin, just shortly 2 hours ago, before polls had actually opened here within the state. But obviously, it's a little divided, to say the very least. I was actually out at a polling location here just shortly this morning, Green Bay East High School. And the amount of voters that have been turning out has, it really hasn't prevented them from turning out, to say the very least. A majority of them have taken precautions, and they are, wearing those face masks, wearing those gloves. We've also seen a number of those polling location volunteers taking those necessary precautions as well, even having the barriers between them and the voters. But it's to say it's divided would be putting it pretty lightly or mildly, I would say.
Well, Calvin, I just read, I'm perusing Twitter here, searching Wisconsin primary, and it's not just the primary election that's going on. There are some general elections going on as well for judgeships there in Wisconsin.
Yeah, I mean it's a quite a big deal here. You know, as you mentioned, it's not just on the federal level, but it's also on the state level as well. So we're talking about a significant impact here, a day that will have a significant impact here within the state.
Nelson, let's go back to the numbers that you've seen as you're out at polling places. Two things I'm curious about. You said a lot of numbers, a lot of people are there. Give me an estimation on percentages of votes that are expected, because primaries, you're looking at 20% of the population would be a good number. Do you think we can get to that number? Obviously, that is something that is important. Secondly, as those folks wait in line, are we getting that 6-foot buffer zone?
Yeah, to answer your first question, I think 20% would work out actually in this scenario. Just right now, as mentioned, I mean, we've been looking at the social distancing precautions being taken place at those polling locations, and one of those polling organizers that I spoke to had mentioned that they had seen a significant rise in the amount of people, but also given the fact that they were having 25 of those mandates under one roof, so quite a number of people turning out at just Green Bay East High School alone. Yeah. And then to answer your second question there, yes, I would say that they are taking, the 6 feet social distancing precautions very, very highly.
All right, Calvin, thank you so much. Calvin Lewis reporting for us out of Green Bay. We appreciate that. Very quickly, I want to show you a tweet from Omar Jimenez. He works for CNN. Take a look at how many people are actually in line and the distance between them. This video is sped up, but you can see that they are distancing. There are cones out, but this line stretches on and stretches on and stretches on to the parking lot, then even further. So the Wisconsin primary right now, amidst a pandemic, this is going on down the street now. Another turn. Very interesting stuff. Amid this pandemic, things are actually looking like voter turnout could be up in this situation. Let's keep with the political theme. Lawmakers say the crisis has shown that medical and pharmaceutical supply chains are critical to our national security. Jesse Tenur has more from one congressman who is working to encourage the federal government to treat medical and defense supplies the same.
Arkansas Congressman French Hill says Americans have been caught off guard by problems with medical and pharmaceutical supply chains amid the coronavirus crisis.
We need to not ever have that happen again.
Hill has introduced legislation that he says would make the U.S. more prepared for the next public health emergency.
We've just realized the last 2 months that a lot of our supply chain is offshore. It has limited number of participants, and sometimes they're all in China.
It would treat medical supplies like ventilators, protective gear, even vaccines, the same way it treats defense supplies needed to build planes, ships, and missiles. The legislation would amend the Defense Production Act, a powerful emergency law that allows a military leader to take over factories and supply chains and distribute the products where needed.
My bill would make sure the president has a strategic plan in place to do that going forward, where we have a little less mystery about this.
Even Hill's Democratic colleagues in the House, like Alabama Congresswoman Terry Sewell, agree that Congress should act to give the DPA more teeth.
Ensuring that not only we can manufacture the equipment we need, but we also can preserve the prescriptions and the drugs that we need stateside.
Hill says he hopes to build support for his plan when Congress returns to the Capitol in the weeks ahead.
Let's go live now to Washington, D.C. Jesse Tenur joins us. Jesse, this is interesting. Obviously, right now, medical supplies, protective equipment are the hot button issue. And it seems like Washington is getting on board, wanting to protect us, just like defensive budget being weapons that protect us.
Exactly. So that's Hill's point too, saying that we shouldn't wait for this, a next pandemic and a next public health emergency to figure out that we're exporting things that could be helping us here, that we're relying too much on resources from other countries. And so that's why he wanted to kind of throw this bill out there to try to amend the Defense Production Act, to kind of already say, hey, look, we're already learning over these past couple months that we just really can't afford to do this again.
It may have bipartisan support. Does it have enough support to pass?
We'll see. Since he just introduced it while all lawmakers have been home, of course he can pick up the phone. There's still a lot of ways that they can talk to each other. But it seems like since this will be for future public health emergencies, it may get sidelined just for the time being while they address different things like phase 4 to work on everything from potentially more direct payments, unemployment, infrastructure, things of that nature, before then tackling an update of sorts to the Defense Production Act that President Trump has been in the news for.
Since you are there in Washington, close to the White House, let's talk about what's going on in Wisconsin, Jesse. Your thoughts on what folks in Washington are saying about the Supreme Court allowing this primary to continue amidst a pandemic?
Yeah, so there's this really already interesting political divide happening right now where there is a Democrat governor who won by a very small margin who ousted the Republican incumbent, but then there's a Republican legislature. They've been going head to head for some time now, and the governor wanted to have a special session called where the lawmakers in his state would address this and postpone the election. That's what he was hoping for. This special session, they gavelled in. We're used to seeing those there in Arkansas too. They gavelled in for about a minute, and they didn't do anything. And so that just shows this political division and gridlock. And so that's why we saw it move all the way through the courts. And then the now conservative Supreme Court with that 5-4 vote said that those elections can go on. And while the presidential primary is, of course, a big ticket item on the ballot in Wisconsin, a lot of people there are looking for other elections that are being had that will decide who's the winner immediately, and that's sheriffs, mayors, things of that nature. And so they were kind of arguing from the Republican side that there was really too much at stake here, since Democrats typically turn out to early voting for a presidential primary.
All right, Jesse Turner, thank you so much. We appreciate that. As more people get over the virus, again, they're moving on. They have immunity. This is something we've talked about. Considering there may have been cases here in the U.S. since December and January, that means plenty of people now cannot get sick from the virus. And the best expert estimates right now is that immunity could last up to 3 years, and it could possibly help others attack this virus. Here's our Dina Blair.
The good news, testing for antibodies is much easier compared to testing for the virus that causes COVID-19.
Luckily, looking at antibodies is a much easier thing. Antibodies are proteins that, again, float around in the bloodstream. They're reasonably stable.
In addition to red and white blood cells, the blood has serum. The serum has many proteins doctors can measure for various ailments. In the case of COVID-19, the infectious disease caused by SARS-CoV-2, when the immune system begins to recognize the viral assailant, it produces two types of antibodies, IgM and IgG. IgM acts rapidly, determining the body's initial response to infection. But over time, IgG intensifies and lasts in the blood, indicating a person has recovered from the infection and now has the immunity that can be detected and possibly donated through their blood. The antibodies potentially provide long-lasting immunity.
It's estimated for this type of virus that it's about 1 to 3 years. And so that's about how long we think somebody will have immunity. So about 1 to 3 years.
So how do doctors find the antibodies? All it takes is a simple finger prick, much like how diabetics test their blood sugar. Just mail in the sample for evaluation. Dr. Elizabeth McNally says at Northwestern Medicine, they're working on getting a system in place with the goal of ultimately running hundreds of antibody tests a day.
What we're looking for is over the next couple of weeks, having something where we can reach out. The best would be a mechanism where we could get blood samples from people at home and get them in and be able to get them results about what type of immunity our community has actually experienced. I think that's going to be critically important for us going forward.
It's now an iconic image of the coronavirus spikes, but they're more than fascinating art. They're actually critical to the formation of antibodies.
When you see all those pictures of the little red spikes sticking out of the virus, that's the spike protein. And very specifically, they're looking at what's called the receptor binding domain. So the part of the spike protein that then attaches to cells. So that's what people are extremely interested in, looking at antibodies to those regions, because that's actually thought to be indicative of recovery and protection.
Just as important, making synthetic antibodies in the lab to help those acutely ill with COVID-19.
If we could come up with an antibody that actually is highly protective, then that could be used for the acutely ill infected person to really cut down on their infection and potentially save their life. So yes, this isn't just a signal of who's been infected and who has immunity, but the real home run would be to figure out some antibodies that we could use therapeutically.
All right, let's go now to Dina Baer live in Chicago. Dina, a home run, that is what we need. That is what we hope for. I guess where is the hope in the medical community that this could be, in fact, that home run, if not a grand slam?
They are so close on this, and they're already doing it in the lab and now wanting to develop multiple tests. There is a warning, though, from Northwestern University, where we interviewed the scientists there, that there are all kinds of companies online saying we can test you and we can find out if you have the antibody. If you get a false positive test, that's not going to help you at all. But the science is there, and they're already doing this. And I want you to think about the future. As we start going back to work and start getting out of this social isolation, we need to know who might not get this, who might not be at risk.
That's good.
Those are the people that we can first start introducing into society and start getting our economy running again, and know that they won't get sick and won't overwhelm the hospitals. Because once we do open the doors and go out again, there's going to be an increase in illness once again. The other thing about this is, by finding the antibodies, by being able to create them in the lab, so not needing a patient who's recovered, for example, they can then move on to developing a vaccine. And that's what we really need if this ends up being cyclical, is a vaccine that's going to protect us in the future.
Dina, that's a great point of being able to inject what we need into our economy. Those are big issues that are going to continue to haunt us until we can get those people back into the economy. You bring up cyclical. If someone has COVID-19 and then they can't get it anymore for 1 to 3 years, is there going to be more strands? Could there be a COVID-20, COVID-21?
That's the great unknown, that this virus will mutate much like other viruses have, and then we would be in a situation like this all over again. And that's what scientists are trying to figure out right now. But because it's so new, that's why it's called the novel coronavirus, they just don't know.
All right, this is fascinating stuff. Dina, thanks for enlightening us here from Chicago. We appreciate your time here on Newsfeed Now. As we were talking about, medical professionals across the country are bracing for the next 2 weeks. That's when cases are expected to peak in the United States. One thing is certain, these heroes will walk into uncharted territories. Here's Alex Dennis.
Professionals across Middle Tennessee brace for the next 2 weeks when COVID-19 cases are expected to peak in the U.S.
That's our big fear, that it does explode.
As Dr. Corey Slovis prepares locally, his focus is also on cities like Seattle, New York, and New Orleans.
We're paying a huge amount of attention at multiple levels as far as how the hospitals and the epicenters are dealing with their overwhelming volume, so that rather than repeating history, we can learn from what worked and what didn't work.
One thing is certain, these heroes will walk into uncharted territory.
I was thinking, when I was an intern, I used to come to work a little scared, or a lot scared, because of how little I knew. Now, I come to work scared that I might get infected. I've never had that fear before.
Yet Dr. Slovis says his fear is met with an outpouring of love from the community he's ready to serve.
I've been an emergency physician now for almost 40 years. I've never seen this kind of appreciation. We almost, other than when we sponsor a lunch and send some pizzas here, no one ever sends us food. And now every day somebody is sending us something. I've been overwhelmed with how kind and generous people are.
He does have one request, that people would remember this COVID-19 pandemic is far from over.
We can't let down our guard or let down our masks.
Alex joins us live from Nashville, Tennessee. Alex, a lot of good stuff in this story. First thing, fear. Fear is something that I think all of us have to deal with when it comes to this. It was enlightening in this story for me to hear a medical professional say, heck yeah, I am afraid. I'm afraid of what is the unknown, just like I was when I was coming up, a young doctor, a young nurse. I didn't know what I was doing. Very similar circumstances here.
You know what I found so interesting is we're looking at these people as heroes, and they are. They're going in their front. They're the faces on the front line, but they're human. right? Like all of us. I know that reporting on it, I've been scared. This is really, like I said in the story, uncharted territory. And it's just a reminder that these people are suiting up and going into the hospitals, not knowing whether or not they're going to get it, not knowing what they're facing. And it's just a really true testament to what they're doing for us.
I want to go to one other thing that he said in this piece. I have been an emergency physician now for almost 40 years. I've never seen this kind of appreciation. I say it's Southerners being Southerners. Right now, it feels like Americans just being Americans.
I think this whole country is going to be looked at as one community as we come through this. I think the top infectious disease doctor, Dr. Fauci, as you know, said it best when he referred a couple of days ago to these, heroes in the hospitals, just like we used to appreciate the heroes returning from war, right? When we were in an airport, we would stand up and applaud. And he said that we should stand and applaud these healthcare workers. And I think that we couldn't do that more now than any other time, because what they're doing, they are heroes. Yeah.
All right, Alex, before you go, I want to ask you one more question. Look, in our line of work, things kind of stop, right? We do these stories and then they stop. Tornado coverage, it stops. Yeah. This one to me seems to keep going on and on and on. For you as a journalist, when you hear a physician say, we're not there yet, it's going to keep going, what does that do for you personally?
Honestly, I'm tired.
Yep.
I'm really tired. Yep. We've been working around the clock. I'm nervous too. My father lives with me. He had a stroke, so he's predisposed. So I'm doing everything I can when I go out there to do those stories to garb up. And I'm just praying nonstop, because just like those doctors, we're essential workers, not as essential as them, but getting the stories out there, you fear that you are going to be the one that brings it back to your household as they shelter in place.
Good stuff.
So it's been scary, but
absolutely.
We're in it.
Pray up. Alex Dennis,
That's
you said
right.
it best. You can follow her at Alex Dennis TV on Twitter. Pray up. Appreciate that. One thing that has just been part of this whole pandemic, TP, toilet paper. Where is it? Who has it? Everybody's trying to get it. It's like a diamond in the rough. It's easy to blame the tissue shortage on hoarders stocking up, but wholesale suppliers say there's a lot more to it. So let's find out what that is. Here's Teresa Weekly.
3 squares? You can't spare 3 squares?
We like to call it stocking up. I don't know that we would call it hoarding.
Oh, I don't have a square to spare. I can't spare a square.
That's a piece of it, because consumer demand is a bit more than usual, but there are many other factors at play.
Rich Hebert is the CEO of Clean It Supply, based in Pennsylvania.
You have reached the sales team.
Prior to this crisis, Hebert says their sales were 80% to businesses and 20% to consumers.
Our business is flip-flop, whereby 80% is B2C and 20% is B2B.
Hebert says FEMA and medical companies are suddenly ordering huge supplies, and they get priority. Not to mention China, where we used to get a lot of our tissue, hasn't been producing.
It's had a pretty significant effect on supply of tissue products in America.
Another thing to consider, where we're all using the bathroom. If we all go an average of 5 times a day, and 3 of those times used to be at work or school, then we're using the John at home 15 times more each week. Multiply that by, say, 4 people in a home, and that's 60 more flushes per week, leaving fewer squares to spare.
I don't have a square to spare.
All right, Teresa joins us from Grand Rapids. Teresa, I got to tell you, that math stinks.
Wouldn't you like to just flush that problem away? Yeah.
Yeah, we did.
You were making lots of faces during that story, Aaron.
Oh, yeah. You were able to see it here. Was that story enlightening for you as you see what's happening at supermarkets, at big box retailers across the country?
Yeah, I assumed it was, oh my gosh, everybody's hoarding, please stop. But that's why I called that CEO, because I wondered, is there more to this? And it was pretty enlightening what he said about just the distribution flow and how much FEMA and medical companies are ordering. And he seems to think that has a lot more to do with it than, and he didn't like the word hoarding, he called it protective stocking. But he thinks that this will all start to even out and the flow of distribution will be a little bit better, maybe in like 90 days, he hopes.
So that was the question is, when is this clog going to be plunged?
How long did you spend thinking of these?
That one actually just came to me. Actually, I'm kind of proud of myself, but I did it with a straight face. That was the fun there. So 90 days.
Yeah, that was the number one thing. We'll just go to the number two thing. No, that's it.
Okay.
I did find some myself, though. We were really running low, so we found some yesterday. So maybe that's a good sign. I don't know.
Good news there, Teresa. Thank you. We appreciate you taking the time to do the number two math for us. We appreciate that.
No problem.
All right, Teresa Weekly out of Grand Rapids. Interesting stuff there. Again, never thought I'd do toilet math, but thanks to Teresa, we have. That is your coronavirus update on this 10:30 edition. We've got another one coming your way 3 p.m. Eastern, 2 p.m. Central, and we will be back right here at 10:30 tomorrow Central Time. See you then, guys. Have a good afternoon.